Welcome, Professor Rich RN here. Today we're going to be going over some basic questions, whether you're preparing for the NCLEX or you're in nursing school looking for additional content. Alright, let's jump right in. Our first question. Which statement would best explain the role of the nurse when planning care for a culturally diverse population? The nurse will plan for care to A. Include care that is culturally congruent with the staff from predetermined criteria. B. Focus only on the needs of the client, ignoring the nurse's beliefs and practices. C. Blend the values of the nurse that are for the good of the client and minimize the client's individual values and beliefs during care. D. Provide care while aware of one's own bias, focusing on the client's individual needs rather than the staff's practices. So give this one some thought. Okay, your correct answer on this one is actually going to be D. Provide care while aware of one's own bias, focusing on the client's individual needs rather than the staff's practices. So with this one, we need to have an understanding of our own personal beliefs and values and biases to provide care for an individual. If we're caring for someone who has obviously different values or cultural beliefs than allows for us, there can be some sort of conflict between the two. So we need to be aware of what we believe, but then also what they believe, okay? And the other ones don't really incorporate that patient-centered care model that we're looking for. All right, your second question. Transcultural nursing implies A. Using a comparative study of cultures to understand similarities and differences across human groups to provide specific individualized care that is culturally appropriate. B. Working in another culture to practice nursing within their limitations. C. Combining all cultural beliefs into a practice that is non-life-threatening approach to minimize cultural barriers for all clients' equality of care. D. Ignoring all cultural differences to provide the best generalized care to all clients. So let's give this one a quick thought. All right, your correct answer on this one is going to be A. So using comparative study of cultures to understand similarities and differences across human groups to provide specific individualized care that is culturally appropriate. Transcultural care is referring to and meaning that understanding and learning of specific cultural practices that the nurse can then integrate or use within their care to care for a specific individual. But that knowledge of lots of cultures is what we're kind of looking for, so they can adapt their care depending on each individual. Okay, next question. When signing a form as a witness, your signature shows that the client A. is fully informed and aware of all consequences. B. was awake and alert and not medicated with narcotics. C. was free to sign without pressure. D. has signed that form and the witness saw it being done. This one's a pretty simple, basic thought, so don't overthink this one. And the correct answer is D, of course, has signed the form and the witness saw it being done. So when you're acting as the witness, you're saying that you saw them sign that form. Okay, those other things, we're not always fully aware of those. So D is the correct answer. Okay, here we go. Our next question. The nurse places an aquathermia pad on a client with a muscle sprain. The nurse informs the client that the pad should be removed within 30 minutes. Why will the nurse return in 30 minutes to remove that pad? A. Reflex vasoconstriction occurs. B. Reflex vasodilation occurs. C. Systemic response occurs. Or D. Local response occurs. So when you're thinking about this question, determine what is the effect of that pad and what is it supposed to do, and give that one some thought. Okay, the correct answer is the nurse is going to return for A is the correct answer because a reflex vasoconstriction is going to occur. So if we apply that heating pad, also known as a K pad, for greater than 1 hour, it's going to cause vasoconstriction. The purpose of placing that pad over a sprain or muscle issue is to allow vasodilation, so increase the blood flow. But over time, too much time, vasoconstriction will occur and it's going to go against the effect that we actually want. Okay, all right, let's jump to this next one. When helping a person through grief work, the nurse knows A, coping mechanisms that were effective in the past are often disregarded in response to the pain of a loss. B, a person's perception of loss has little to do with the grieving process. C, the sequencing of stages of grief may occur in order. They may be skipped or they may reoccur. D, most clients want to be left alone. So think way back to fundamentals of nursing when you learned about death and dying and grief, and see if you can come up with this answer. Hopefully you did. Correct one on this one is going to be C. The sequencing of stages of grief may occur in order. They may be skipped or they may reoccur, right? There is those generalized steps of grief that people will go through, but depending on that individual, they can go in various order. And it also depends on that circumstance that they are. It also can depend on their culture and their beliefs as well. So a step might be skipped, a step might go back and be repeated, etc. So it can vary when someone is going through that grief process. All right, as we jump to our next one, when caring for a terminally ill client, it is important for the nurse to maintain the client's dignity. This can be facilitated by A, spending time to let the clients share their life experiences, B, decreasing emphasis on attending to the client's appearance because it only increases their fatigue, C, making decisions for clients so that they do not have to make them, D, placing the client in a private room to provide privacy at all times. Again, think about this one as providing some sort of patient-centered care. Which one would be best for that? The correct answer is going to be A, spending time to let the clients share their life experiences. A couple reasons why this would be the correct answer. One, if we're spending time with the client, we're also allowing for that trust, that therapeutic relationship to be built with that client. Therefore, when they express their wishes, then we can meet their needs, right? B is not going to be correct because emphasize on the client's appearance only because it increases their fatigue. That's incorrect. If they want to get up and do their hair and makeup, let's help them, right? We're there for them. C, making decisions for them. We never want to make decisions for our patients. We want to educate them on risks and benefits associated with decisions that they make, but they will ultimately get to choose that. And providing the client in a private room, we don't want them to be alone, especially if there's family members around or other people. We want to, be there for the patient and allow family to spend time with their loved ones. All right, our next question is, a client's family member says to the nurse, the doctor said he will provide palliative care. What does that mean? The nurse's best response to that is A, palliative care is given to those who have less than 6 months to live. B, palliative care aims to reduce or relieve the symptoms of a disease. C, the goal of palliative care is to effect a cure of a serious illness or disease. D, palliative care means the client and family take a more passive role and the doctor focuses on the physiological needs of the client. The location of the death will most likely occur in the hospital setting. So for this one, you need to know the difference between palliative care and then kind of what hospice care is as well, because some of those answers are intertwined with what we have here. So the correct answer on this one is going to be B. Palliative care aims to reduce the symptoms of the disease. All right, so if we look at the other ones, A, palliative care is in regards to 6 months. That's specifically talking about hospice. So we can roll that one out. And then B, of course, is the correct answer. And then the goal of palliative care is not to cure any sort of disease. It is to reduce the symptoms and relieve the symptoms of what's going on with our client or patient and give them better quality of life in their end times. Also, D is incorrect because palliative care means the family does not take a more passive role. They can take whatever role they choose. It's just, again, the focus is on reducing those symptoms. Thank you so much for joining me. Please like and subscribe for more content.